Good morning, everyone. This is Wei Yu Zhang. I am the Community Advocacy Manager at California Pan-Ethnic Health Network. So I will be your facilitator today. Thank you so much for joining this webinar. Next slide, please. So today's webinar is focused on data and evaluation. It is the very last one of the 8-part training series in the Mobilizing for Health Equity webinar series. And so this webinar series has been designed to support Having Our Say, which is a statewide coalition of about 30 organizations that works to ensure communities of color are included in the state's policymaking process. And so before I go into the webinar and then introduce our speakers, I would like to share a few housekeeping items. So first of all, if you do have questions at during the webinar presentation, please submit your questions via the question box. If you don't see it on your screen, you may need to click on the orange arrow that says that would give you control panel. And so we will answer all of the questions at the end of the presentation. Number two, today's webinar is being recorded, and so after the webinar, you will be able to access the recording and the slides on the Having Our Say website in about 2 weeks. So we welcome you to revisit the content and also share it with other folks. Last but not least, there is going to be an end of the webinar quick evaluation survey. So we encourage you to fill out the survey because your feedback helps us measure our work and improve our webinars in the future. Next slide. So we have 2 speakers for today's webinar on data and evaluation. First, we have Dan Ichinos, and so Dan is the research director at AAPI Civic Engagement Fund. Dan has over 20 years of experience leading research that uses census, voter, and other data to address problems that faces the diverse Asian American, Native Hawaiian, Pacific Islander communities. He is an expert in both census policy and census data, a veteran of 2 statewide redistricting campaigns, and has led, producing dozens of demographics reports. Dan was most recently director of the Demographic Research Project at Asian Americans Advancing Justice Los Angeles. We also have Jeffrey Kuo. So Jeffrey is our grants and project manager at CPEN. Before joining CPEN, he served as the development director at Insure the Uninsured Project. He managed the organization's foundation relations and provided program support to statewide and regional health reform work groups. Jeffrey's experience includes grant writing, grant management, and program support. So without further ado, I'm going to hand over to Dan to talk about data.
Great, thanks for you. Again, my name is Dan Ichinos. I directed the API Civic Engagement Fund's research arm. So the fund is a collaborative fund established in 2014 by the Carnegie Corporation, Haas Junior Fund, Ford Foundation, and Culture Foundation, designed to support small grassroots groups doing really amazing organizing work in Asian American and Pacific Islander communities throughout the country, working towards progressive change. So as a research director, I guess I do 3 main things. One is to kind of manage data and data systems, ensuring that our small grassroots groups have access to the best data and data systems that they need to do the great work that they do. I do research on Asian American and Pacific Islander civic engagement, and will also be engaged in the next redistricting process. So I thought I would, next slide, please. So I thought I'd structure this around 4 things that I think most of us try to show a funder or a policymaker when we're engaging them. Many of us like to demonstrate that our communities are large and growing, that they're important in our geographic area, that they're ethnically diverse, and that they have specific needs. Next slide. So I'll go ahead and go through these 4 things one by one, and just kind of talk a little bit about the kinds of data you might want to bring to bear when trying to demonstrate this, and talk a little bit about some of the challenges that you might experience. So first, our communities are large and growing, right? Most of us like to demonstrate to a funder that the communities that we serve are significant, right? And by and large, that means measuring or demonstrating population size. So for population size, there's probably, and you know, as we go through this, I'll be talking primarily about census data, but not exclusively. Measuring population size is done through, I guess, primarily 3 files. I think most of us know about the decennial census, and I know probably all of you are engaged in some kind of 2020 census outreach at the moment. Certainly, the decennial census is only conducted once every 10 years, right? And as we approach the next census, you know, there's certainly a need for updated data on the size of our communities. And so there's 2 census data sets that are useful. The first are population estimates. So the Census Bureau has a population estimates program that uses data on what they know about immigration, births, deaths, and other population dynamics to adjust the decennial census data up to the present day. The most recent population estimates that the Bureau has released are from 2018. Now, the decennial census and the population estimates are kind of the preferred sources of data to capture population counts. You know, many of us are familiar with the American Community Survey, right, which in contrast to the decennial census is actually a survey that goes on an ongoing basis that collects data, not just estimating the size of population, but it's really focused on looking at the incidence of particular socioeconomic characteristics in communities. Now, because the ACS has a smaller sample size, it's generally not as good as these other 2 sources of data for capturing population size. But given that we're in 2018, you know, many people are starting to lean on it, and you know, I think if it's something that folks need to lean on, given the importance of articulating the current size of the population, we can do that. You know, I mentioned that, you know, folks are engaged in 2020 work. I thought I'd mention that the 2020 census data are due to arrive in late March and early April of 2021. So that's when folks can kind of look forward to digging into some of those new data and really reap the rewards of all the great work that folks have been doing to engage communities around the census. That'll be specifically for redistricting. So the first file is called PL 94171. It will be released around that time, and then other data will be released subsequent to that. Next slide. Okay. So certainly, most of us, I think, on this call are engaging communities of color. So understanding some dynamics around the measurement of the population size of by race and Hispanic origin are really critical. Some folks may be familiar with the distinction between measuring race alone or alone in combination. Starting in 2000, the Census Bureau allowed multiracial people to indicate more than one race in their response to the census, and that while it made for a more accurate representation of racial dynamics in the United States, it does create some complications in terms of measurement. So the alone captures the single race population, right? So folks who are one race and no other. Alone or in combination includes both those who are single race and those who are multiracial. And in the work that I've done over the years, I've found that the alone or in combination figure is really the best one to use, given that it provides the largest, kind of more inclusive measure of the size of our communities. Next slide. So we also like to demonstrate that our communities are growing. So a basic measurement of that is provided here. So generally what we do is to take the latest estimate, subtract the old estimate from that, and then divide it by the old estimate. So for example, if you're using, say, population estimates for the state of California, comparing to the decennial census, you would take the current population estimate, subtract the decennial census figure for that population, and then just divide it by the decennial census figure for that population. And that gives you the percent growth between 2 points in time, right? So, you know, oftentimes, particularly in Asian American Pacific Islander communities, you know, we see many of our folks, their communities are not as large as others, right? And so being able to demonstrate growth in addition to the size of population is really critical to smaller immigrant communities who are really looking to demonstrate the importance of their communities. The next slide. Okay, so another thing that we like to demonstrate is that our communities are important in a particular geographic area. And so I thought I would review some census geographies. So I've listed, 5 common ones here. So, you know, the data are certainly available for the United States, every state in the country, every county in the country. You know, many times we'll look to capture data for cities, and the Census Bureau does that, but the common measure that a lot of us use to capture cities is called the census designated place, and that's just a geography that includes both cities and unincorporated areas. So that can be important when you are engaging communities in areas that are not incorporated. And so the Census Bureau will aggregate data to a lot of those unincorporated areas. And then finally, the census tract is oftentimes the smallest level of geography that folks may use. Next slide. So this is kind of a hierarchy of census geographies that includes many of those and some that that you might not be familiar with. But I think it's important to kind of understand the range of geographies that are available. They can include congressional districts and state legislative districts for those of you doing advocacy. They can also include zip codes. For those of you who are kind of engaging communities that are better defined by zip codes. One thing to keep in mind, obviously, is at higher levels of geography, so at the nation or state level, you have more data, but less geographic specificity. And then as you go down, you have less data to finer levels of geography, less data, but more geographic specificity. So that's a dynamic that as we kind of navigate census data is important to keep in mind, right? That it may be given the issue that you're addressing and the communities that you're engaging, that you need to find that sweet spot, right, between the geography that you want, but also the data that you want that captures not only the issue you're interested in, but also the communities. Next slide. Okay, so particularly in Asian American Pacific Islander communities, it's important to demonstrate that our communities are ethnically diverse. And so Luckily, census data is among the best source for disaggregated data on a whole host of communities. The two primary sources for those data include the decennial census, obviously, and the American Community Survey. Now, it's important to recognize that there are limitations to some of these, which we'll get into in a little bit. Let's go to the next slide. You can see the whole range of ethnic groups that the Census Bureau captures data on. And so I thought I would list some here to give you a sense of just how many groups data are available for. One, I mentioned the kind of complications. The Census Bureau is not necessarily the best. It's a large federal agency. It's not necessarily the best on race and understanding our communities. I think they've done a great job in terms of understanding the importance of getting data out for specific ethnic groups. But many times, we'll have to struggle with them to get them to refer to our groups in the correct way, to capture ethnic groups rather than national origin groups. So you can see as you go through this list of, and I'm not going to go through it, but this list of groups, that there are quite a few, but maybe some that are captured in ways that are less than ideal. But in any event, I listed some ancestry groups for African origin Americans, the ethnic groups for Asian Americans, Pacific Islanders, and then ethnic groups for Latinx communities. So you can see just the breadth of data that are available for racial subgroups or ethnic groups. And maybe one thing to flag too here is that many of us may refer to these communities as ethnic groups. You may also hear the Census Bureau refer to them as racial subgroups. So just so you kind of understand that they're referring to the same thing. Okay, next slide. Okay, and obviously we also want to demonstrate that our communities have specific needs. So capturing socioeconomic characteristics for our communities are going to be really critical. There are two sources of data that I lean on a lot to do that. The first is the American Community Survey's selected population tables. And that's a set of tables for which the Census Bureau provides maximum data disaggregation. And so as somebody who works in Asian American Pacific Islander communities, I'm using that file a lot. So if you're working with a particular ethnic group and you're working with that group in, say, a county or a metropolitan area, you're going to lean on that file a lot. I thought I'd also mention the broader American Community Survey, the latest version of which is was produced for 2018. Actually, I think those data are also rolling out now. So there may not be a full set of data there. But both of, the American Community Survey, generally speaking, captures just about almost any socioeconomic characteristic you can imagine. I mentioned poverty, language, and health insurance coverage here, but also a whole host of other characteristics. So maybe some to point out that that's where there are weaknesses, some local education data is better sourced elsewhere, as is health data, which we'll get to in a second. Next slide. One thing to keep in mind when working with American Community Survey data is that there's generally two versions of them. You'll see 1-year data and 5-year data. And so the 1-year data are generally better for capturing kind of the current state of a community. The problem is that those data are only provided for geographies that include 60,000 people or more. And so there's a lot of limitations in terms of the geographies and groups for which those data are available. 5-year data are much better for looking at small groups and small geographies. So again, you know, I do a lot of work with the 5-year data. Next slide. So those data are available online, and the Census Bureau over the years has really done a great job of getting a lot of those data, making a lot of those data available to folks easily. It is just in the process of transitioning from the old American Fact Finder. If this was a room, I'd ask folks to raise their hands to how many folks had worked with the American Fact Finder. They're transitioning over to an interface called data.census.gov, which is kind of a simplified interface, which should make access easier for folks who don't necessarily have training as a data analyst. I won't go into kind of how to access data through the interface given time constraints, but in a sec I'll reference some training resources. But suffice to say that all data that the Census Bureau releases can be found here. Okay, next slide. Okay, so I mentioned that the Census Bureau, one of the gaps in their data is health, right? So we know that, particularly given your amazing work, that you know, we need to understand health outcomes, health behaviors. So the best source of data in California, as many of you probably already know, over the past, I want to say 15 years or so, 20 years, has been the California Health Interview Survey, or CHIS. And that is a statewide survey. I think annually they survey maybe around 20,000 households. In a variety of languages. And one of the things that was remarkable when CHIS started was the number of languages that they conducted interviews in. And I believe that's become fewer over the years, but nevertheless, they do conduct many of these interviews in language, which obviously is critical to developing an accurate understanding of health outcomes and behaviors in immigrant communities. So there's a lot in CHIS, health conditions, mental health, health insurance coverage, specifically a lot of data on Medi-Cal, both at a statewide level and in more local areas, public program participation, and other stuff. Next slide. So the primary portal for accessing CHIS data is Ask CHIS, and this is a screenshot from their interface. You start an account and dig in. You can see here that the interface allows you to specify the geographic area for which you'd like data, the topic. You can compare topics. You can get the data for specific racial and I think a more limited number of ethnic groups relative to the census, and then you can get those data for specific years. For more advanced users, you can also aggregate data over years, and so. I know one of the things that we had done in the past looking at Pacific Islander data is to actually, to ensure a better, more reliable sample was to aggregate those data over a multiple year period. But so for folks who can really dig in, there's data that you can download that will allow you to do that. But again, CHIS is a data set that a lot of folks who are looking to access data on health outcomes, health behaviors lean on heavily. Next slide. So I mentioned, I know this is kind of a brief overview, kind of identifying a few important resources to answer kind of these, or to help articulate these 4 issues, right? Demonstrating that communities are large and growing, that our communities are important in a targeted geographic area, that our communities are ethnically diverse, and that they have specific needs. So training resources for data.census.gov are considerable online. They recently started this Census Academy that the website is listed here. And you can click on that link and really dive in. So I know they produced a series called Data Gems that are kind of brief videos that kind of dive into kind of accessing data in specific ways. Like I know they have one on accessing data by race, by Hispanic origin, on specific topics. But they're really great little videos that kind of teach you how to access the data using the new interface. So one thing important to note as the Census Bureau is making this transition, that those of us who are used to accessing data through American Fact Finder, they won't be integrating any, or they stopped integrating new data after June of this year, and we'll do away with Fact Finder in September of next year. So rest in peace, American Fact Finder. It was really a great interface. So I'm curious to see it worked all the kinks out of data.census.gov. Next slide. And then finally, with CHIS, CHIS also has a great place you can go to access learnings around accessing their data. They have a Ask CHIS On Demand Learning Center. The link is here. They actually are releasing their new 28 data today. And so if you have time at noon, you can hop over to their webinar, which will talk a little bit about the new data and probably share some of the initial findings. So that's really exciting. So that's it. I hope, and I realize it's kind of covering a lot in a short period, but dig into these training resources as you work to understand both these sources of great data and dive in.
Thank you so much, Dan. Wow, I feel like I've never heard data in like 20 minutes for so many times. But next we have Jeffrey, and again, like I said, if you have questions, submit them via the question box, and we'll address the questions at the end. Jeffrey, please.
All right. Thank you, Wei-Yu and Dan. Dan, thank you for that introduction to the world of data. I really loved his presentation because he looked into all the ways that we can use data to articulate the need for the work that our organizations do. And that's a really critical part of building support and investment for our communities. And just a fun fact, all the data sources he discussed are the same ones that CPEN uses to create district fact sheets that we use when we do district visits and lobby days. So if you ever wanted to know how we did that, that's exactly how we did it. Anyways, my presentation is going to look a little more at what comes after the data piece. So once you've developed a program and you're conducting a program in the community, how do you evaluate that program's success, and how do you use that evaluation to improve your programs and build support for them? Next slide. And so my goal today is just to provide an introduction and overview to evaluating the implementation and the impact of a community advocacy or outreach program. And throughout this presentation, I'm going to look at 3 things. What is an evaluation? Why should we do an evaluation? And lastly, how do you do an evaluation? And for today, I've specifically focused on community advocacy and outreach programs because these can be a little tricky to evaluate compared to other programs that may have more numerical outcomes, like a community health intervention where you could just see if people's health, like if their blood pressure is improving. Those evaluations are sometimes more obvious to conduct. So today we're going to focus more on activities that sometimes there's not a clear what was your impact. And next slide. And one more slide. So what is an evaluation? And at its core, an evaluation is really just a set of questions and the answers to those questions that we ask to gauge how effective a program is at achieving its goals. A lot of times when we ask and answer those questions, we use that to develop a written narrative or report, but the form it takes really depends on the specifics of your needs. And at the end of the day, while there's no single way to do an evaluation, we do want to do the following things. Excuse me. We want to firstly assess the implementation of a program. So how did we do it? We want to assess the effectiveness of a program. How did it change the world around it? And then we lastly want to demonstrate the success of a program to other stakeholders. Next slide. And I want to just pause and emphasize evaluations look at two key parts of a program: implementation and impact. And these can be easily conflated, but it's really important to separate out the two, because we want to be able to look at how a program was carried out, and we want to look at how a program changes the world around it. And we need to think about these separately because they're not completely correlated. You can have a program that was very difficult to implement, but had a very strong and positive community impact. Conversely, you may have a program that was pretty easy to implement, but turned out to not really achieve its goals. So when we think about implementation, we're looking at questions such as, what did we do? How did we do it? What were the successes we had when trying to implement the program? What challenges did we face when trying to implement the program? And what did we learn about implementing programs like this when doing it? And that's really focused on the process of carrying out a program, like how did we hold these trainings? How did we engage community members throughout the life cycle of our program? On the other hand, we can also look at impact. And impact asks questions more of, who did we impact? How did we impact them? Was the impact the one that we wanted? Were there unexpected impacts on the people that we did affect? And what did we learn from the way people were affected? And here the focus is more on how your program changes the environment around it, whether that's how the community is engaging on a given issue, improving knowledge among community members, or influencing public policy, as is the goal for a lot of our advocacy programs. Next slide. So why do an evaluation? Next slide. And it really comes down to three things. But just to summarize, asking questions about your program's implementation and impact helps you learn what were the important lessons learned, helps you make adjustments to your strategy, and ultimately helps you improve your programs and your organization's overall direction. Next slide. And just to be a little more specific, here is a not completely all-inclusive list, but many of the important reasons we do evaluations for program improvement. It helps you understand what is and isn't working, what impact is or isn't occurring, and helps you make improvements. For strategic planning, you can understand how a program aligns with your organization's priorities and goals. Stakeholder engagement, you can better communicate what your program does in the community and what that impact is going to be on the stakeholders who are affected. And lastly, building support. Evaluation is really important when it comes to communicating the impact of your program to current and future funders. In addition, by doing an evaluation, you can better communicate the full needs of your program when you're looking for support. Next slide. So now this is the big how. How do you evaluate your program? Next slide. And once again, every evaluation is different because it has to be tailored to your program and the stakeholders that you're trying to explain your program to. But the process is typically similar. Firstly, determine what to evaluate. Figure out what the questions are that you need to ask and what data you can collect to answer those questions. Next would be to collect data. As you implement your program and track its impact, start collecting the data that you can use to answer those questions. Third is to analyze the data. So once your program is complete, or once your program has reached a certain point where you want to look back and start pulling out the lessons learned, look at the data that you've collected and try to answer your evaluation questions. This is also when you might consider if the data raises new questions or insights you didn't think of before when you were determining what to evaluate. And lastly, report your findings. And this is when you take all the insights and answers to the questions you gained throughout this whole process and package them into a form that is targeted at your audience. For instance, maybe you want to report how well a program is working to your leadership. So you might prepare a presentation or a short report. Or maybe this is for a grant report. So you would use whatever format that the funder is asking for your evaluation. Next slide. Now, for our advocacy and community engagement programs, there's not always the clearest set of evaluation questions. It's not like a medical program where we can ask, did this improve somebody's blood pressure, or did this, improve their overall health? But here are some starting points that may help you to think of evaluation questions that are tailored to your programs. Firstly, process and implementation. Remember, this is important to evaluate because it helps us understand how difficult it was to implement the program, what the big successes were when we implemented a program, and how much support is needed to implement that program. You can ask questions such as, how many events did we hold? How many new partners did we connect with? If you are doing advocacy letters or petitions, how many advocacy letters did we send out? Or maybe how many people signed our petitions? You can even track things like how many social media posts did we do on a given advocacy topic. But once again, this is focusing really on what were the things that we did to carry this program out. And secondly, think about the overall goals your program has. When you're trying to think about questions that assess outcomes and effectiveness, the goals your program have will really guide those questions. For instance, if you're trying to raise the public profile of a community health issue, you might want to track what local governments are doing about that issue and see if you or your members are being featured in media or social media about that issue. Some other questions that you might think about were like, what new policies were passed that incorporated our priorities? Or conversely, what unwanted policies failed to pass? As many of you may remember, we engaged on a large whole-scale effort to defend the ACA after the 2016 election. And, you can definitely say that, the failure of ACA repeal is definitely an outcome. Were we invited to provide testimony before a government body as a result of our work? Being invited as an expert on a given issue is definitely an indicator of how effective your organization is at putting trusted information about an issue out there. Were any of our staff members or program participants interviewed by the media because of our work? Did program participants report feeling more knowledgeable and engaged about an issue after participating in our events? These are all questions that will help you to gauge how is your work impacting the world around you. Next slide. So based on your evaluation questions, you can now start to think about the data that you need to collect to do an evaluation. And then after you figure out what data you need to collect, you can also figure out how it can be collected. And I'll give a few examples. Next slide. So for example, my organization is collaborating with partner organizations in a region to hold community outreach events in diverse communities. So maybe the first question we can start with is just how many community events did we hold? So we're trying to look at the process of carrying out this program. And the first data point that comes to mind is the number of events we held. So when we collect the data, we could, just as an example, maybe it looks different for you, we can create a spreadsheet that collects key information about all those events, right? Like where was that event? When was that event? Who came to that event? And maybe just a quick link to the agenda or some other background information. So later when you're looking back, you have all that information in one place ready for you to analyze. Next slide. Okay. Example, my organization is holding a series of local convenings that seek to build advocates' understanding of an important community issue so they can be better informed advocates. So we can ask, did our partners feel more knowledgeable and engaged after our events? To try and track that, we can look at, we could do an event evaluation that asks partners how, before and after the event, what were their knowledge and engagement levels? We could also seek direct partner feedback. To collect this data, a paper evaluation is probably the simplest way to do it. CPIN does this at a lot of our events as well. We can also hold partner interviews to just get a narrative from partners who took part in our events to see what did they like, what did they learn, and what their suggestions might be for improvement. Next slide. All right, and this is a slightly more specific example, but my organization will conduct a media advocacy campaign to raise awareness of asthma in the local community and build support for the use of community health workers to provide remediation. One question we could ask is, what new policies have passed that incorporated our priorities? And then to track that, we would be looking and monitoring relevant legislation and policy proposal. And remember, it's not just legislation, right? Administrative actions may be of interest here too. You may want to be tracking what your local health department is doing, or maybe what a government agency like DHCS is doing. And we can just create a spreadsheet that lists all the different policy proposals and the legislation and local government actions that are of relevance to these questions. Next slide. So at this point, we've asked ourselves a lot of questions. We've come up with data. We've collected the data, and now it's time to dive into it and analyze that data. And during this stage, really, you're just going to look through all this data that you've collected, try to answer your questions, identify the key themes that are emerging from the data and from your questions, and then determine the next steps. These are some guiding questions that might help you do that. So how successful were you at implementing your program? Did you encounter unexpected challenges or successes? These questions are focused on the process of carrying out your program. How effective was your program at achieving its goals? Did you have the impact you intended? Were there unintended impacts? Once again, here we're looking at just the overall, the way your program impacted the environment around you. Did anything change in the environment since the start of the program? How might have that affected your program's implementation or impact? And these questions try to get at the fact that your programs don't exist in a vacuum, right? You may have collected a lot of data and noticed, something happened that I didn't expect. Why might that be? And sometimes the reason is that something major happened in the policy or community environment that your program takes place in. For example, for folks that were doing outreach and enrollment work, when the ACA passed, that really changed the game for people who were trying to get people into affordable coverage options. That would definitely be a major environmental change that you would want to recognize when you're evaluating the success of your program. Likewise, developments such as public charge may have negatively impacted some of your efforts to do outreach and enrollment because of the environment of disinformation and fear. That's also something that you should acknowledge and recognize that it could have had an impact on your program. And then lastly, what are the key lessons that you've learned? What would you do the same next time, and what might you change if you did this again? Here we just want to take everything that we've learned in their totality and draw out some lessons learned and best practices. This is especially important if you're sharing out your evaluation to partners to help other people replicate your results. If you want other people to adopt your programs as a model, it can be really helpful to provide some insight about the challenges you faced and what other people might want to consider if they're trying to do the same thing in their communities. Next slide. Lastly, we're going to talk about reporting your findings. And this is going to look really different depending on who you report to. An evaluation really depends on its target audience. An evaluation that's meant for internal program staff is going to focus more on process, whereas evaluations that are targeted at funders and other external parties will be primarily focused on outcomes. But at the end of the day, the evaluation really needs to emphasize what was achieved and learned, as opposed to just being a list of the things that you did. Focus on the strongest conclusions from your analysis and emphasize the impact of your program. How is the world now different as a result of what you did? Once again, to the extent that it's relevant to the lessons learned, discuss the process. Are there important implementation details that should be considered in the future if you continue this work, or that if someone else tries to replicate your work? And lastly, if possible, provide concrete details from your data to share out. And this can be quantitative data, numerical data, such as the number of policies that passed, the number of activities you held, feedback from events like ratings and other participant scores. And it can also be qualitative data. Just because it doesn't have a number attached to it doesn't mean it's not important. It's still data that's relevant to your program and the story of your program. Event narratives of what happened, narratives about how participants were affected by your program, summary of major advocacy wins, discussion of the stakeholders that you engaged, especially if you're talking to a partner who doesn't know who you might have engaged with. Next slide. So I think that brings us to the end of the presentation. So Wei Yu, I'm going to throw it back to you.
Okay, thank you so much, Jeffrey. So I feel like I've learned a lot in terms of both where we can look for data as well as how we can evaluate a program. So thanks to both of you. So in terms of, so now we're at the Q&A time. I know that there's still some of you on the webinar. If you have questions, please submit them via the question box. So I do want to, while you're doing that, I do want to invite Jeffrey and Dan. So I know that you guys are like chatting about like data, and I really love the conversations that we had even during the preparation for this webinar. You know, just like, do you guys have questions for each other? I will give you guys like some time to ask each other questions. Jeffrey, you can go first.
Thank you, Wei Yu. Well, Dan, I think one thing that I saw in your presentation that I think would be interesting to discuss with the larger group is that you mentioned that the measure was race and Hispanic origin, and I was wondering if you could talk a bit about why it's race and Hispanic origin as opposed to just race.
Yeah, I saw that someone had asked that as well. So it's, I mentioned that the Census Bureau has not been the best in terms of its kind of understanding of race issues and its integration into its program. The Bureau did a lot of testing. I think there's generally been some a lot of recognition that that the race and Hispanic origin question should be integrated, right? And there was a lot of testing that was done in advance of 2020 that really underscored the importance of doing that. You know, rather, you know, when you have two separate questions, we get a lot of folks in Latinx communities who either indicate some other race in the race question or even indicate white, right? So the work that they had done really showed there was just a lot of confusion, and so they were looking to integrate the two questions into a single race question. And then the Trump administration hit, and unfortunately those efforts to integrate the two questions were derailed. So you know, for now, we're stuck with the two separate questions. And so, you know, it's just a matter of navigating those two, you know, looking for capturing Latinx communities in the Hispanic origin question, other communities in the race question. I should mention too that, you know, if you're looking to include data on white communities, generally the best measure for that is actually looking at what they call the non-Hispanic white alone population in the Hispanic origin question. Because otherwise you're capturing, if you're just using the race question, you're capturing white communities that include a lot of Latinx folks. So, so yeah, it's an imperfect approach, and it's something I think the lifers in the Census Bureau are really looking to change. So maybe something for you know, the next 10 years.
Thank you. So I just got a question from the audience from Jessica Nila. Sorry if I'm pronouncing your name wrong, but the question is for both Jeffrey and Dan. So in either of the work you do you incorporate or name racism and capitalism and its impact on people's health?
Hi, Jessica. This is Jeffrey. I think it is really important to acknowledge that, yeah, these are the root causes for a lot of the things that we're seeing in the community. Admittedly, when you do things like evaluation with external partners, um, I think we also have to acknowledge that sometimes we're working with partners who are not necessarily, sometimes we're working with corporate partners and others, but I think it's still important to name those things as much as we can. Absolutely.
Yeah, and I know for a lot of our partners who are doing grassroots work around a whole host of progressive issues nationally, that addressing the impact of capitalism is really an important part of what they're doing to just really mitigate its impact on our communities. So, yeah, I know that's really important for our folks.
Yeah, that's a difficult question, I would say. We try to show, the impact of, social determinants of health and try to address some of those issues in our work, especially for having our say, like a lot of our partners do, civic engagement or, addressing racial bias and like healthcare. And so we definitely try to address that in terms of data. It's hard to, I think it's like the direction that we all want to move into, to use like data to make a case.
For sure. Actually, just to add one more thing to that, I do think that the use of data can be really helpful too, because a lot of times what we are trying to do is paint kind of a picture of exactly what that means when we say racism and capitalism impacts people's health. For instance, for CPAN, right, illustrating health disparities by race is really central to all the work we do, because at the end of the day, we do have a healthcare system that does not treat people equally, and generally does not treat people of color very well, which is borne out by the health disparities that we highlight in our lobbying visits, in the legislation we push, and even in the work we are proposing to funders. Likewise, we know that income is a big factor impacting people's health. And the two do intersect. And these are things that we do use data every day to continue to elucidate exactly how racism and capitalism is impacting people's health.
Yeah, and I think, kind of looking at concrete data, a lot of folks look at measures of inequality, right? So the difference between the wealth of the 1% and the wealth of the 99%, right? And being able to track changes in that inequality and the wealth gap is really critical, and something that folks have noted and used to underscore the importance of anti-capitalist type programs.
Absolutely, and I think all the data sets we use do offer fairly detailed information on race and income. Not always perfect, but it is possible to take a lot of the things that we look at and figure out what it looks like, when disaggregated by income and race. This is especially the case for the California Health Interview Survey, where built into every query, you can actually break out different bands of income and different race groups to see how it differs between those groups, or combinations of those groups. You could look at even just like one race group and then break it apart by income, or you could look at one income group and then break it apart by race to see how the intersectionality between income, capitalism, race, discrimination, how does that play out on people's health and wellness? So thank you. Good question.
Yeah, we also got a comment from the audience, Harry Kim. So they said that racecounts.org is a good resource to look at racial data within California. So thank you for that comment. Check out the website. In terms of, so I do have a question for both of you. In terms of like collecting data, sometimes I think that advocates are frustrated with just the lack of data, right? Like for instance, right now, one example is for the 2020 census data, a lot of the LGBTQ advocates pushed for a collection of SOGI, sexual orientation, gender identity data, but that didn't happen. And also like currently, to document the chilling effect of public charge, we don't really have any ways to like really measure that and see how many people are disenrolling from, let's say, a health program because of being scared of, public charge impact. And so if you could talk about, have you been involved in advocating for like the collection of new data, or what are some of the ways that we can address it?
Yeah, maybe I'll start by answering the first question. I mentioned that there was a lot of advocacy going on before the 2020 census to get the Bureau to, structure the 2020 census in a way that made more sense for our communities. And, some of that advocacy including better measurement at all, right, of sexual orientation, gender identity in the census. And unfortunately, those efforts failed. There have been folks like folks at the Williams Institute at UCLA who have been doing a lot of great work, kind of making the best with the data that are available to capture the needs of folks in the LGBTQ community. So in the absence of a better measure in the 2020 census, I'd recommend folks go to the Williams Institute website, and they've produced a number of reports. They have a lot of great infographics and data interfaces that provide a lot of great data on those communities.
Yeah, and I think for us to, we definitely do advocacy around data collection for CPEN. Obviously, disaggregated data is really one of the biggest things, as well as the collection of sexual orientation and gender identity data, as well as language. Because without those kinds of data, we can't even tell what the disparities are. So a lot of our work around, working with health systems, working on healthcare quality, one of our most consistent and important policy asks to policymakers has been that you need to start collecting data on race, ethnicity, language, on sexual orientation, gender identity, because we know that there are disparities there, but we can't quantify it until the data is broken out. And, a lot of times it's challenging, admittedly. We're working with really big systems that have a lot of inertia and are sometimes reluctant to add, one more question to their demographic intake form. But we do think this is really important because that forms the basis for doing future advocacy around specific disparities. I know, yeah, definitely, though, the point about the lack of data, we feel that too all the time. And I think it does reflect that for the longest time, a lot of these systems that did collect data, we're not really thinking about the fact that communities are diverse. A lot of the people that have made these decisions under the assumption that minorities were not really the main focus of the systems that were serving their communities. And as a result, we ended up with a lot of data collection systems that didn't really think about the difference between, for example, the many diverse Asian and Pacific Islander communities. So that continues to be a major area of advocacy for us going forward.
Thank you so much. There's one last question from the audience, Phyllis Tai. So they asked, I've heard that CHIS more of a last resort data. Is that true? Or too bad that we cannot ask for clarification. But
it's a good question. Dan, did you want to take a pass at this?
Yeah. So I think a lot of folks would consider CHIS to be a great source of data. As with any data source, there are weaknesses, right? And I mentioned that when CHIS first started, they were able to support a lot more language assistance in their data collection. So I don't think they translate into as many languages as they used to, which is maybe one constraint. Another constraint certainly is the fact that even though they're collecting data from 20,000 households, it's still a sample, right? And so the data certainly are of higher quality statewide or regionally, as opposed to in smaller communities, right? So say neighborhoods or even some smaller counties. So
That's right.
so I wouldn't discount the value of those data, but certainly as you move from, say, statewide advocacy to local advocacy, you may want to look at other sources of data.
I think that's right. For us, we've generally used CHIS at the county and statewide level. And even then, for small counties, because CHIS is a telephone administered survey, it's not really feasible for them to get very large sample counts to the extent that small counties are accurately represented. There are a few data measures where CHIS can be more reliable, especially for certain California-specific things that the Census Bureau may not be tracking as well. I think one area that I generally prefer CHIS over the U.S. Census Bureau is actually the measures for health insurance coverage, because the Census Bureau uses a statistical sample and the decennial census that was taken in 2010 before the Affordable Care Act passed, so the ACS numbers, I find, tend to underplay how many people are actually covered in a given area compared to CHIS. But once again, the census generally has a much larger sample size because they have more resources and can get better data as a result. So it really depends on the data source that you're looking at. I think it's definitely true that it's probably the best California-specific resource we have, and it asks a lot of questions that no one else is asking. So it could be a great way, even if you don't have data for like a specific community, to like do a broad screen and figure out, where are the disparities trending towards, and where do we need to look closer, and maybe find other experts on the ground to learn what's going on.
Yeah, and it's now being run by Ninez Ponce, who's the former policy director at the Health Forum. So, she certainly understands the importance of collecting good data on our communities, and so I think under her leadership, she would certainly be open to improvements in what they're doing.
All right, so thank you. We're at time, and I really want to thank both of you again, and everyone that's on the webinar that engaged with us and stayed until this point. Again, since we talked about data and evaluation, at the end of the webinar, there's going to be a really short survey for you to fill out. So give us your feedback for us to improve our work in the future. And again, I hope you have a great rest of your week, and we will send out the recording and the materials in about 2 weeks. Thank you so much.
Thank you, everyone.
Thanks, folks.